Lissy, and I'm with Texas A&M AgriLife Extension in Calhoun County. And this is a recording of the Health Talk Express Lunch and Learn series that we're doing. This one focuses on lowering your blood pressure and keeping track of a good, healthy blood pressure. Okay, so I'm going to share my screen now, and we will start with the program. Hopefully, you guys have already taken your pre-survey. If not, it'd be real helpful to us if you could stop now and take your pre-survey and then watch this video. It works better for us to get better results of what you've learned from our program if you do it that way. Okay, so hopefully you're not seeing where my lines are, and I can see that y'all can see me talking. And so those of you who need closed captioning, it's there at the bottom. Okay. So this lady right here is Nellie, and she's the author, and she's a minister, and she's Keeper of Me is the name of her book. And she's walking the talk regarding heart health. Her testimony is simple. She wants to survive. She wants to thrive, not just survive. High blood pressure doesn't have to be a death sentence. If you're diagnosed, you have to make the decision of how you want to live the rest of your life. Her story began when she was 20 years old, and she started having constant headaches or frequent headaches. At first, she associated them with her high pressure job. She soon learned that she had high blood pressure, and it's a common condition among African Americans. This was her diagnosis. She had an increased risk for other health conditions such as diabetes. And Nellie recalls that her most difficult challenge was taking her medications every day. Now, that's also a problem I had for quite a few years. I would take it and I'd forget, and I would take it and I'd forget. Now that I'm thinking about it, I need to go make sure that I checked. I did take it this morning. Now that I think about it, I did. But I started using a pill box, and that might be helpful for you guys. If you are diagnosed with any disease, or if you need to take any medication, you need to have a constant pill box. Some people, it works for them just to keep their medicine next to their toothbrush. Every morning they'll take it, and every night they take it. But that didn't work well for me, and I thought, I don't think it's good for my medicine to be in a high humidity place. She pointed out that she had to be compliant. You can't skip your medication one day or 2 days and expect it to work the next time you take it. She learned how to make lifestyle changes. She started eating more vegetables. She increased her physical activity. She lowered her salt intake, and she began to manage her stress better. Through these improvements, Nellie lost 16 pounds and lowered her blood pressure to 111/77, which is definitely in the healthy range. Positive thinking also played a big role in helping her take charge of her health. And she says, as women, we often take care of other people and we put ourselves second. You have to take care of yourself. Your heart is a central part of your body. Without it, nothing else matters. Okay, so that's her story. Normally in Calhoun County, I'd be telling you a story about one of my loved ones who didn't have time to go get medicine that this person needed, and so they put it off and they put it off. By the time I convinced them to go to the doctor, they had to actually have a heart scan to make sure that they hadn't done any damage from not taking their medication because their blood pressure was so high. Now, can you recall the last time you had your blood pressure checked? If you go to the doctor, most people get theirs checked every time, right? How many times have you had it tested in the last 6 months? Just when you went to the doctor? It used to be easy. We could just go to a pharmacy or H-E-B or Walmart or any grocery store. They would often have that little machine you could sit down. But I've seen ours has been closed down for a while. Hopefully it kicks back in and we can sit down and take our blood pressure there. Okay? If you can't remember, then it's probably time to have your blood pressure checked. But okay. When we do this live, I get some responses and I can respond better. Okay. So, routinely monitoring your blood pressure is an important practice to prevent high blood pressure, which is also, called hypertension. Screening is one of the 7 basics of cardiovascular health for adults. Having high blood pressure means that the pressure in your blood vessels is higher than it should be. High blood pressure is a major risk factor for cardiovascular disease and stroke. In the U.S., 1 in 3 Americans have high blood pressure. That's 75 million Americans over the age of 20. Now, nearly half of those diagnosed with high blood pressure do not have it under control. Sometimes it's because they don't know, but sometimes it's because they know and they just don't feel bad, so they don't take their medicine. Uncontrolled hypertension is associated with an increased use of health resources, with $49 billion being spent annually in direct and indirect medical costs. Let me see if I can move. No, I can't. Okay. Of the 75 million with high blood pressure, like I said, about half of them have it uncontrolled. That's because about 11.5 million aren't aware that they have it. 7 million are aware that they have it, but like I said, they don't think they have to, they're not feeling bad, so they don't take their medicine. And then there's 16 million who are aware that they have it and they're treating it, but it's not an adequate treatment. Okay. So we want you to know what the numbers mean. And I can't change the screen. Okay, so it's got 2 numbers, and I'm sure you've all heard 120 over 80 is excellent, and we'll be talking about that in a little bit. But the first number is called the systolic number, and the bottom number is called the diastolic number. Okay, and the systolic number is usually higher. It's because if you think of your heart as a balloon, and there's a constant pressure in it, well, that would be the diastolic when it's at rest. But if you were to squeeze that balloon, then that's where we're talking the systolic number. When your heart's beating, it's squeezing. And so the top number, it'll be higher because the pressure would be higher inside. Okay. And it's read as millimeters of mercury. Okay. Now, normal is considered less than 120 over 80. Okay. And so if you have a number, as in Nellie's was what, 117 over 77 or something like that, that's a good blood pressure. It's normal. Pre-hypertension, you can see 120 to 139 and that bottom number being less than 80. But if that bottom number gets over 80, then that's pre-hypertension too. You can see that if it gets over 80, that's actually high blood pressure. Stage 1 is up to 89, but at 90, that's stage 2 high blood pressure. And you can see the danger zone. 180 or higher or 120 or higher is it's that crisis where you definitely need to go to the doctor. Okay. Okay. The U.S. Preventative Task Force recommends screening for high blood pressure of ages 18 and over. Elevated blood pressure is defined as being over 120 to 129 or a diastolic of more than 80. Okay. Okay. Screening is recommended every 2 years for with people with blood pressure of below 120 over 80. Okay. And it's recommended yearly for adults 40 and over, and for those who are at increased risk for high blood pressure. Persons who are at increased risk are those who are obese, or African Americans, or don't have, and anybody without any blood pressure, without any risk factors, they need to be screened every 3 to 5 years. Now, high blood pressure is common among African Americans and seniors. Race, age, family, and genetics are 4 uncontrollable high blood pressure risk factors. You can't change that. You are who you are. But research shows that hypertension in U.S. African Americans is the highest in the world, and it's expected to increase. While high blood pressure is more common in seniors and African Americans, there is a group that it's getting higher in, and that's those younger adults with poor health habits. Their blood pressure is going up, and some poor health habits they might have are inactivity and being overweight. So what can you do? Well, you can reduce your sodium intake, you can increase your physical activity, you can maintain a healthy weight, manage your stress, just like Nellie was doing, lower your alcohol intake, and eat foods rich in potassium, such as greens, oranges, and fat-free yogurt. And then I bet there's some other things you can think of. It's like, I've always heard bananas are good. Yes, and avocados too. But remember, bananas are high in sugar, and avocados are high in fat. But there is a dietary approach I want to talk about, and it's called the DASH diet. Okay, my internet is not playing correctly. Oh, good. Sorry. Okay, and it's dietary approach to stopping hypertension. Okay, and it's a healthy eating plan based on nutritional studies. Okay, you can see it limits the sodium, it limits the saturated fat, and it increases vegetables and fruits and low-fat dairy and high fiber and lean protein. Okay, so unlike the normal American diet, we'll see that is high in sodium, high in saturated fat, and high in added sugars, and low in potassium, low in calcium, low in iron, low in vitamin D. The DASH diet is high in all the things we need it to be high in and low in the things we need it to be low in. Now, protein isn't listed as being a problem in the typical American diet because most Americans get a good amount of protein. So, how much do you need? Well, there's a worksheet that I attached when we sent out this where it explains what servings are, okay? But I'll have to talk about it. You can see it's 6 to 8 servings of grains, and make them whole grains. Try and get as many whole grains as possible. That increases the fiber that you'll have. And then 4 to 5 servings of vegetables, and then 4 to 5 servings of fruits. Now, about half cup of vegetables, cooked vegetables, is a serving of vegetables. So we're talking 8 to 10 servings of vegetables a day, which if you're getting that, great job, because very few people get that many vegetables. I run programs and I ask, and I'm lucky if I have people who get 1 to 2 servings of vegetables a day and 1 to 2 servings of fruit a day. Most people get less than that. And then 2 to 3 servings of fat-free or low-fat milk. Now, a serving of milk, actual milk, is a cup. Okay, so think about it. Most of us, if we drink out of a pretty big glass, we're getting maybe 2 cups at that point in time. But a cup of yogurt would be that. But cheese, you don't need a cup of cheese. You eat a lower amount of that. 1.5 ounces is what we're talking for cheese. Now, fruits, I forgot to say, a serving of that is like 1 medium fruit. We're not talking like Honeycrisp. Sometimes they look like they weigh 2 pounds each. You don't eat the whole Honeycrisp apple. Lean meats. I know you're going 6 servings of lean meats. That's great. That is really 6 ounces. So you could eat 2 ounces at each meal, or 3 ounces at lunch and 3 ounces at dinner, and that's the protein you need for a day. Okay. And of course, we're talking lean proteins, not we're not talking eating salami here. Not that I don't like salami. Okay. And then 2 to 3 servings of unsaturated fats and oils. Now, a serving of fats and oils is 1 teaspoon of soft margarine or 1 teaspoon of vegetable oil. You can have a tablespoon of mayonnaise or 2 tablespoons of salad dressing. That's a serving of fats. And then weekly, you can have 4 to 5 servings of nuts, seeds, and legumes. Okay, and legumes include beans, cooked beans that are dried, from dried, and peas and lentils. But nuts, 2 tablespoons of seeds, 2 tablespoons of peanut butter, or 1.5 ounces of nuts. So it's not a whole bunch of nuts there, guys, because they're very high in fat. And then it says 5 or less servings of sweets and added sugars. And you might be thinking, oh, good, I can have a piece of cake here, a cup of ice cream here. No, not really. 1 tablespoon of sugar is a serving of sweets. So 1 tablespoon of jelly or jam, a 1/2 cup of sorbet or gelatin dessert, and a cup of lemonade is what we're talking about. So we're not talking a whole piece of cake or anything like that. You got to watch that. Okay, so hopefully that was helpful. Now, blood pressure is often called the silent killer because it has no warning signs or symptoms, and many people don't even know that they have it. The only way to know if you have it is to measure your blood pressure. Okay, so what's wrong with having high blood pressure? Well, high blood pressure can damage blood vessels, upsets multiple organs, the heart, the kidneys, the brains, the eyes, and it can lead to a heart attack, stroke, or chronic kidney disease. So let's be among those people who take care of that. Okay. We also need to remember to be physically active because it reduces cardiovascular disease, it reduces diabetes, it reduces obesity, and it lowers stress, which helps to lower blood pressure, and it helps you maintain and achieve a healthy weight. Now, some other steps we need to take is measure, monitor, and maintain. Well, first step's easy. We measure. Now, we already discussed that you can go to the doctor's office and measure your blood pressure. And when things calm down a little bit, or maybe even now in some of the places that you live, you can find a blood pressure machine over at one of the stores that you go to, and that's always a good way to do it. And then having a home manual or electronic blood pressure cuff is a good idea. They're not that expensive, so if you can afford it, it might be something you might want to consider. Okay, but when you're getting your reading, you can see I was leaning forward. You lean back. Okay, don't talk or eat during the check. I can't imagine eating at a doctor's office while you're getting your blood pressure checked, but maybe at home if they're saying don't eat. Okay, avoid caffeine and smoke 30 minutes and smoking minutes before measuring. We would also encourage you to stop smoking if you can at all make that happen, because studies show that it's just not a great habit to have. Make sure both of your feet are on the floor. They often have to tell me, shh, be quiet, because I'm usually talking. And when I'm at the doctor's office, and they always have to tell me to uncross my legs because my legs are always crossed. And then wear a short sleeve shirt or roll up your sleeves. Okay. And remember that if you're stressed, or if there's a really cold temperature, or you're exercising, or right after you're exercising, your blood pressure might be higher than normal. And then there's certain medications that can affect your blood pressure one way or the other. Okay, monitor. That means keep track of it. Write it down when you get your blood pressure checked. If you're under treatment, you ought to have it monitored and measured daily. Okay, without high blood pressure, yearly you can go with it. But if you have high blood pressure and you're not taking medication for it, you need to do it at least a few times a week just to make sure it's under control. And then maintain. Okay. Key activity in the measure, monitor, and maintain process are regularly check your blood pressure, track the changes, and adopt healthy lifestyle. So, we're talking, you do need to increase activity, increase your fruits and vegetables, lower your sodium intake. Okay, your doctor may prescribe some medication. If the doctor gave you medication to take, then you need to take it. Forgot to mention, never increase your activity without talking to your doctor first. Some of us, most of the time, the doctor will say it's totally fine. Excuse me. But there are those of us who cannot increase our physical activity without doctor's permission. So you don't know who you are, so you need to talk to your doctor before you increase your physical activity. And never increase that physical activity to a crazy amount right away, like from sitting on the couch for, a month at a time to running 5K. Most people aren't capable of doing that kind of a big change. Slowly. A friend of mine says, some movement is better than no movement. Just increase that motion, and make it a little bit better for yourself. Okay? Because you're worth it. You want to thrive, not just survive. With 67 million Americans diagnosed with high blood pressure each year, we can benefit by making a personal goal to know our blood pressure numbers. Nellie reminds us that we are worth it. Okay. Preventing high blood pressure saves money for both the individual and society. In 2010, it was estimated that direct and indirect costs for high blood pressure was $46 million. Indirect cost includes the cost of physicians, medications, but it also includes taking time off from work and having other people have to take off time to take you to the doctors. And medications are not fully covered by insurance all the time. Okay. I did forget to talk about that white coat hypertension, where people sometimes their blood pressure is high just at the doctor's office. Well, they've been looking into that, and it being high at the doctor's office means that it's probably high when you're in high stress situations. And people aren't just under stress at the doctor's office. So you might want to take your blood pressure a little bit more often and keep track of it and report it to the doctor so that we can make sure that your blood pressure is normally at a really good number. Okay. And remember, friends and families are affected by your blood pressure too. If you're not taking care of your blood pressure gives you a headache, then most people aren't as happy and friendly when they have a headache, or if they're not feeling well. And other people around you have to, they get affected when you're not feeling well. Okay. Measure and monitor and maintain is an easy to remember guide to prevent high blood pressure. Make it your personal pledge this week and all weeks to get your blood pressure checked if you don't know your numbers. And if you do, keep track of your blood pressure readings to maintain good health. I hope you enjoyed this program. I hope to see you next Monday at 12:15. You can sign on at 12. We're always on by 12 just to make sure there aren't any problems. We will be discussing next week. They're going to be discussing activity and increasing your activity. Remember, if you're going to increase your activity, talk to your doctor first. Have a nice day. Thank you very much.